Hi, I'm Dr. Patrick Foy, MD. I'm the director of the Coccyx Pain Center or Tailbone Pain Center here in the United States, online at www.tailbonedoctor.com. This is the next in a series of videos covering a glimpse at the information within the different chapters of my book, Tailbone Pain Relief Now. And in this video, we're going to talk about Chapter 5, which is Causes of Tailbone Pain. And Chapter 5 is a chapter that's really important, but it's really just the introduction to a whole series of other chapters about causes of tailbone pain. For this section, we're really looking at, this section of the book is broken down into, the first section of the book is finding the cause for your tailbone pain, and then the second section is treatments for tailbone pain. And the reason, of course, that the first section comes first is because before you can start with treatment, you really should have a good evaluation to try to find what's causing the tailbone pain in the first place. So Chapter 5 is that introduction to the different causes of tailbone pain. Some people will have a history of trauma, like a slip and a fall, as shown in the illustration here. But the other patients will have no history of such trauma. There's lots of different things that can cause tailbone pain. Some of them are listed down here, and I can tell you that these are the things that are going to be covered in some of the subsequent chapters that are coming up. So in the subsequent chapters, we're going to have chapters talking about unstable joints when there's increased or hypermobility of the joints. We'll talk about tailbone fractures and dislocations and bone spurs and arthritis and abnormal positions where the tailbone is either flexed too far forward or extended too far backwards, for example. We'll talk about pain from the sympathetic nervous system at the coccyx, which can be very, very important. We'll talk about cancer or malignancies at the coccyx, infections in the area, all of those kinds of things. So really, this chapter, Chapter 5, is just an overview that those are going to be the coming chapters in the book. But it's really, really important to have kind of that list of possible causes in your head, and for your doctor hopefully to have that list of possible causes in his or her head, so that we're not just treating this as, oh, somebody has symptoms, but we haven't looked yet to see why they're having those symptoms. It's very, very important to discern or distinguish what's causing the pain in the first place. It is very, very common that patients fly in to see me from around the country and internationally, and they've had tailbone pain for years, and not a single physician has actually try to figure out exactly what's causing it, and often just from looking at the imaging studies that were done years ago or imaging studies that we have done here at the initial evaluation, we'll be able within a single office visit to solve that mystery, and often it's something very simple like a bone spur or an unstable joint or arthritis, or in some cases worse things like cancer or malignancies. It's really important, again, to make a diagnosis first and then build the treatment based upon what the diagnosis has found. Yes, it is true that there are some cases where the cause of the tailbone pain cannot be figured out. Medically, the term for that, they call it idiopathic, which just means that the doctor is not sure what the underlying cause is. They'll call it idiopathic coccydynia, which just means coccydynia, tailbone pain, that the doctor doesn't have a specific cause anatomically figured out. But that is a small percentage of the cases. I would say that's probably less than 10% of patients. The vast majority, if you do a proper evaluation, you have the right imaging studies done, and you evaluate and look at them properly and with diligence and care, you can usually find anatomically the cause, and you can correlate that with the patient's symptoms and their physical exam findings. Probably many of you who are watching this video, if you have tailbone pain, I would not be surprised if you've been suffering for months or years, and have seen maybe multiple doctors and still not have an explanation for what's causing your pain. I'd be interested. Post your comments down below with your thoughts or experiences in this area. Do you know exactly what's causing your tailbone pain? Has anybody looked? Have they tried to figure it out? Were you just told that it's idiopathic, meaning we don't know? Post your comments down below. Myself and others watching the video will be interested to read those and respond to those. If you're looking to come and see me or find more information from me online, best place to go for that is www.tailbonedoctor.com. If you're looking for a copy of the book, the best place to go for that is www.tailbonebook.com, and on that website I have links to, depending what country you're in, whether to get that book through Amazon in your local country or through other ways. Again, whether you want the paperback copy or the electronic copy, the ebook copy, which you can get and read that and download that in any country in the world. The links to where to get, and you do not need a special electronic book reader or anything for that, just internet access. So anyway, the links for where to get all of that for the book is www.tailbonebook.com, and it'll direct you to the right place depending what you're looking for and where you're at. All right, I hope that information is helpful. Post your comments down below. I'll be interested to read those. Bye-bye now.